Hi everyone and welcome to my channel. I'm Sonia and on my channel we talk about health, lifestyle trends and travel. And so thanks for joining me today, and we're going to be doing part B or part 2 of infertility, and we're talking about endometriosis. And yes, you may notice my nice scarf here. This is from Nepal, and no, it's not real Burberry, but hey, it's lovely and it's pretty chilly here in Victoria at the moment. So apart from what I'm wearing, let's get on with what is endometriosis. So I'm going to explain what is endometriosis, the signs and symptoms, and the treatment that you can have. So it is thought that retrograde menstruation is how endometriosis occurs. So what is endometriosis? Endometriosis is an inflammatory process, and it's characterised by lesions of endometrium-like tissue outside the uterus, commonly affecting women of reproductive age. Now, this endometrial-like tissue should not be out of the uterus, it should be in the uterus. And what happens with that is it changes the same as if it was in your uterus. So your tissue starts getting nice and plump, you know, in your first few days after your period. It starts to build up again, and your endometrial lining or uterus lining is getting ready to receive an embryo. And it's nice and lush. Well, so is this tissue anywhere else in your body that it's gone to. So it can be your bladder, it can be your bowel, it can even go to your lungs. So it's getting fatter and thicker and plush. And then when nothing happens, there's no embryo, there's no implantation of an embryo, it's like, oh, I don't need this lining anymore. And so it sloughs off, the same sloughs off wherever else it is positioned. And that's what we call a menstrual cycle or a period. So, of course, this can lead to things like pain and other things, but it's essential that you understand that 176 million women actually have endometriosis. Now, why haven't we found a cure? Why don't we understand it better? I guess we haven't actually made it known that this is a problem, that it does need to be addressed. You know, sometimes I think in health, women are looked over, and if it was a man's disease, it would be cured by now. Did I say that? I don't know. Did I? Anyway, so why do you get endometriosis, or how does it happen? It is thought, and as I said, it's not well understood. Well, why isn't it? As mentioned, endometriosis is considered a difficult disease and complex, and it causes the dysregulation of the endocrine system as well as the immunity system, the immune system. There is evidence that there is a complex bidirectional interaction between endometriosis and the microbiome, and studies have found that there are like 4 elevated levels of specific bacteria that are found in women with endometriosis that are not found in the levels of other women. So that's pretty interesting. You know, we hear a lot on gut biome and how it affects our health. It is so important. So the signs and symptoms are primarily it causes painful periods or chronic pain. It doesn't even have to be cyclic with your periods. And as you can imagine, because that lining is thickening and then shedding, it does cause pain or discomfort. So painful sexual intercourse can be a symptom as well as constipation. And the severity of pain is not reflective of how great the endometriosis is advanced. So a person can have no symptoms and have advanced endometriosis. So how do we diagnose it? By great history taking and examination, and sometimes a laparoscopy. So the treatment is putting a woman on hormone therapy, so something like the contraceptive pill or some other form or combination of hormone therapy, and maybe laparoscopy to remove any endometrial tissue that could be on other areas of their organs. So there are 4 stages of endometriosis. 1 is minimal, 2 is mild, 3 is moderate, and 4 is severe. And of course, it depends on where you are on that spectrum and how much pain you're having. That will determine the treatment that you will receive. So I hope that this has been information that has been beneficial in your learning. I hope that you don't have endometriosis. I really do. I know that having something like this, even after my childbearing years, I had my uterus removed at the age of 36 just because of my endometriosis, which is a young age to have your uterus removed. But hey, I didn't need it anymore. I had 2 kids. I didn't want any more. But I can tell you it was the best thing I ever did. And I was so much more comfortable from there on. No more periods. It was great. So that's my story. But I hope you've learned some new things today. And if you like learning new things about your health, then you need to either look at some of my other clips on my channel and definitely subscribe, because I'd love to be with you. And I learn, you learn, and we all benefit. And this channel is for health information and sharing great health information. Okay, so bye for now. Bye.